Great. Thank you for joining us this evening, especially since I just learned that it's some of the playoffs with the basketball. I'm not a sports person, so I know it's a big night. So students, thank you so much for joining us for this panel. We're joined by a really great group of folks doing work all across health in some ways that you might not have thought of. That's the title. So we're joined tonight by Dave Ingram, who is a researcher, writer, and retired consultant on risk and risk management. He serves as a member of the board of the Society of Actuaries and has served in a variety of volunteer roles for the SOA, IAA, and ASB. He's recently taken up working with large language models and has created over 100 custom chatbots on ChatGPT, Gemini, and Poe. Dave is also an editor of the new SOA Research Institute Actuarial Intelligence Bulletin. Sabina Goodmanson graduated from Lehigh in 2017 with a BS in biology. In 2021, she graduated from Sarah Lawrence College in New York with a master's in human genetics and genetic counseling. Since then, she's worked as a pediatric genetic counselor at Seattle Children's Hospital in Seattle, Washington. She's a member of the medical genetics team working in the outpatient setting and provides genetic counseling services and expertise to children with many different features, including autism, intellectual disability, epilepsy, multiple congenital anomalies, hearing loss, and tumors. Sabina helps children, their families, and their doctors find a genetic diagnosis that explains their medical and developmental differences. She works to help families understand what their genetic diagnosis means for the future and connects them with the right resources. Dr. Julie Jenkins has worked in abortion care since 1991 and as a women's and gender-related nurse practitioner since 2005, and was previously the lead plaintiff in the federal ACLU lawsuit to successfully overturn Maine's physician-only abortion law. In
Mhm.
her role as the Clinicians in Abortion Care Program Strategist for the National Abortion Federation, Julie leads national efforts to support advanced practice clinicians as abortion providers, works to shift the traditional abortion care paradigm through movement, collaboration, and advocacy, and coordinates efforts for policy change, practice guidelines, and training of advanced practice clinicians. Sarah Martinez is a former certified child life specialist who currently serves as co-executive director of the Mindful Child Initiative, where she leads efforts to integrate mindfulness education into schools and community settings throughout the Lehigh Valley. With a background in public health, Sarah approaches this work through a population health lens, recognizing MCI as both an educational and public health intervention. She's passionate about addressing the social determinants of health, reducing health inequities, and creating systems of care that support children, families, and educators, especially in communities that need these resources most. Her work focuses on building sustainable, preventable approaches that strengthen mental health, resilience, and overall well-being at both the individual and community levels. Taylor Willison is a senior strategy officer at the Gates Foundation based in Seattle, Washington, where she works across the global health and global development divisions to improve health outcomes for low and middle income populations. Prior to joining the foundation, she spent several years on Amazon's corporate development team, leading the integration of acquired companies into Amazon. She began her career at PwC and M&A consulting after graduating from Lehigh University with a degree in economics and a minor in political science. So thank you so much for joining us, everybody. And students, if you have questions and are worried that you're going to forget what those questions are, feel free to put those into the Q&A and we will do our best to get to them. And Dr. Dolan, off to you.
Thanks so much, Jen. Thanks for organizing the panel and welcome, students. I'm so glad you're taking time this evening to hear about some really interesting careers. I hope it's inspiring. We're going to dig in a little bit. And I want to start with Sabina. So Sabina, can you tell us about your career path? from your undergraduate degree to now? I mean, we now know what you majored in, but go ahead and feel free to mention it again, and then call on our next person when you're finished.
Yeah.
Thanks.
I started at Lehigh working towards a bachelor's in biology. I did it because I really liked bodies and health, and I thought they were so cool. And I thought, I'm going to be a doctor because that's what people do if they like biology and they like talking to people. But I quickly learned that was not the right lifestyle choice for me. So I thought, what else do you do with a biology degree? Oh, you can become a researcher. So I dabbled in bench science, also not the right choice. And eventually I found genetic counseling, which was a nice combination of being at the cutting edge of medicine and science and also getting lots of time to be face to face with children and families and help them figure out what's going on. And so from Lehigh, I did a postbac at the NIH, again, on my bench science dabbling days, before doing my master's degree in genetic counseling. And I've been at my current institution, so Seattle Children's Hospital, ever since graduating there. Yeah. Oh, and Popcorn Taylor.
Thanks, Sabina. So I majored in economics at Lehigh from the College of Arts and Sciences. So I was very much on the business track when I was in undergrad. And at the time, everyone in the business school was going to either Wall Street or consulting. And I didn't really have a perspective on what I wanted to do. I'd kind of intentionally picked economics as the generalist major from the business school where I could try a bunch of things and just see what I would become passionate about. And so I ended up joining PwC doing consulting specifically within mergers and acquisitions. And I really enjoyed the problem solving aspects of the work, the team environment that I was a part of. It was a very, fast paced, challenging environment. So I enjoyed that as well. But I eventually wanted to do the same kind of work, but pick a singular organization so that I could move from a consulting role and do the same type of work in-house. And so that led me to Amazon, and I moved from New York City to Seattle. And I was doing a lot of the same kind of work, building this like strategy and operations skill set. And COVID had hit. And around that time, everybody was thinking not just about what they do, but why they do it. And I had come across some health related work on like a COVID testing initiative at Amazon. And I also worked on the acquisition of PillPack, which is an online pharmacy. And so I just kind of felt a pull towards more mission driven work. And the Gates Foundation has such a large prominence in the Seattle area. And I did not know that there was a generalist track for people like myself who come from more of a business or corporate background. And so through my days at Amazon, I was actually able to get my foot in the door in my current team called the Foundation Strategy Office, where I'm in really an internal consulting role where I get to work across all of the program strategy teams to solve global health and development related problems. And I will popcorn to Sarah.
Yeah. So I had a similar start. Undergrad, I went to University of Delaware and I thought I wanted to go to medical school. So I was exercise physiology major, but took all the the pre-med courses, and was doing an internship at NYU. And I was taking a patient to MRI, and I heard a woman talking through the MRI machine doing like guided imagery and deep breathing with a child. And I thought I wanted to do pediatrics once I went to medical school. So I asked who that woman was, and they said, oh, it's a certified child life specialist. And I asked what that was. And it's essentially the psychosocial aspect of medicine where you take a certain amount of courses undergrad in child development, child psych, and education, and then most child life specialists then get their master's degree, but you can just do your internship and get certified. So I did that at Nemours at DuPont Children's Hospital. It's a 600-hour internship. I became certified, and then I started working in the pediatric ER at Robert Wood Johnson for about 8 years. I worked there, and I got my MPH at Rutgers while I was working in the ER. and essentially worked with children to make their hospitalization process as least traumatic as possible through preparation of new diagnosis, surgery procedures, and then supporting them through the process. So I worked in the PDR for 8 years, then moved back to the Lehigh Valley and realized the skills that I was using with the kids in a traumatic situation. Was technically mindfulness, which is this buzzword, but really it's just breathing and helping them cope through an event. And I wanted to teach kids across the board, whether they're going through a traumatic event in that moment or not, these skills. So I currently co-lead the Mindful Child Initiative, which started as a small after-school program in 2013, and we currently serve 7,500 kids a week. We're in tons of classrooms. We have 21 teachers that push in and teach these skills. So, yeah, I will popcorn it to David.
Thank you. Well, I graduated from Lehigh in 1973 with a degree in math. And I said to everybody before the session here that when I started at Lehigh, it was all male. And you can see that's changed. Uh, and with a degree in math at that time, there weren't a lot of the kind of interesting quantitative jobs available. It was like, well, yeah, you go and teach math, and I didn't want to teach. And I eventually figured out there was this profession, the actuarial profession, that used math a lot. And the actuaries are the primary analysts in the insurance industry. And basically, what we're trained to do is to design and maintain insurance programs so that so that insurance companies can exist over the long run and pay out the claims that we're supposed to pay. And I worked for about 25 years in two insurance companies in Philadelphia, doing a little bit of everything. My first 5 years, I was an actuarial programmer, and then spent about a dozen years in the corporate department, doing things like competitor analysis, profit and risk studies. Eventually became the head of that department, and then I left doing that, moved from Philadelphia to New York, and spent the last 25 years or so of my career working with a lot of different companies as a consultant, as a rating analyst, and as a risk management advisor. And I concentrated on risk management as my specialty then. And had some really exciting experiences when I was with the rating agency. I did that right before the financial crisis, and as a rating analyst, I talked to most of the companies that you saw in the headlines during the financial crisis. So I have some great insider information that I have confidentiality agreements that I can't tell anybody. So who's left? Julie?
Hello, I'm Julie Jenkins, she, her, hers. Um, when I was, so I, growing up, my stepfather was an OBGYN and my mom was a nurse who taught childbirth classes and ran a college health center. So that was my sort of I was sort of steeped in all of that. When I went to college, I was very interested in sexual and reproductive health, but I did not think I wanted to be a physician or a nurse or a nurse practitioner or any of those things. So I started out doing human development, and I took women's studies as a minor. And I started working in healthcare clinics around reproductive health care, an abortion clinic in our community, um, where my stepfather was actually training the physicians there. And I did that for 5 years. And then I went out to massage school after graduation in New Mexico. And I worked at a Planned Parenthood there while I was in massage school. And then I took a couple years and taught skiing and did worked as a massage therapist before um, realizing, oh, no, I think I have to go back and become a nurse practitioner, because this really is the work that I want to do. And I still didn't want to be a physician, but I wanted to work in abortion care. And so everyone that I ran into said to me, well, nurse practitioners can't do abortion care. And I said, we just need to change some laws and then we will be able to, because it should be within our scope of practice. And so it was a very naive sort of approach to things, but now here we are, and we have changed a bunch of laws. At that time, there were only 4 states where we could do procedural care due to physician-only laws being implemented after Roe v. Wade happened in 1973. There were 4 states that did not write physician-only language into their laws, and so those places, advanced practice clinicians were able to provide care. Since that time, and due to our case and legislation in New York and a big study in California and an AG opinion in Washington, we have gone from 4 states where we can provide procedural abortion care to now 22. And we have another lawsuit pending in Arizona. So that is, and I was a clinician for a number of years, a nurse practitioner in women's health, providing direct care, before I went back, got my doctorate in executive leadership, and then have been doing policy work in order to continue to make these changes and to fix practice traps in states where they have already overturned their physician-only laws.
Thank you guys so much. Incredibly interesting and diverse, career paths. So we already have a question. I want to invite all the students who are joining the webinar to enter a question as soon as it occurs to you, and then I'll weave it in, when it seems like the right time. So I'm going to go ahead and voice this question. So this question is really for Taylor. So you're on the spot, Taylor. The question is, does the Gates Foundation hire new graduates?
Great question. The one thing that I have learned about the Gates Foundation is that they oftentimes hire individuals who have they hire subject matter experts across a variety of fields. And so these are usually individuals that have decades of experience. I would be the exception to that because I came in through this business and generalist track, which is just a very small fraction of the people who work at the foundation. So I personally don't know of many undergraduates who have a direct pathway from undergrad into the foundation, just because the level of specialization required in the roles requires advanced education and oftentimes a PhD.
Thank you so much. Thanks for answering that. It's a great question. So obviously, please drop in questions when you have them. So curious about what a typical workday looks like for each of you all. I guess let's start actually with Sarah on this question.
Okay, so I think my prior job as a child life specialist to me is a little bit more unique in the sense is right now I'm like a nonprofit leader, which is also exciting. But as a child life specialist in the PDR, I really was part of the medical team. And as children came in, I would look at the acuity, see why they were there. And I had tons of medical kits that aligned with tons of different reasons why a child would be in the ER. So the main reason for our role would be to go in and explain what was about to happen, what they were going to see, experience, feel, smell, and then support them throughout that process. So that was really my shift, was looking at the screen, seeing why kids were there, going in, preparing whatever they were going to experience, support them through that, and then move on to the next child. So really like any other healthcare provider in the ER, and then working as a team. So at Robert Wood Johnson, there's something called One Voice. So in a pediatric trauma bay, if the child was conscious, they only heard my voice. So I was right at their head explaining what was happening, that they were cutting off their clothes, they were placing an IV. What is an IV? If I could quickly explain what was happening as they were dealing with the medical aspect, I was really right in the child's ear, explaining exactly what they were going to be experiencing. And the whole team knew that. So it was sort of just part of the process. If they weren't conscious, I was with the siblings and or parents, whoever was in the trauma bay, explaining to them what was happening and what was going on and supporting them through the process. So yeah, I'll pass it to Julie.
So at this point, a lot of my day is spent in phone calls to various um, around various policy related issues. So, there's work that we're doing in Illinois, there's work that we're doing in New Jersey, there's work that we're doing in California. I co-facilitate something called the Clinician Abortion Training Collaborative, which brings together all five of the advanced practice clinician training programs in the country. We didn't have any of those until 2024 because we didn't have enough states where we were able to provide. And then, we had many conversations about the fact that we could change as many laws as we wanted, but until we figured out how to get people trained, it wasn't going to make a difference. And it's not an equitable training path to be like, oh, I was in the right place at the right time, and someone happened to be kind enough to train me. So we're working very, very much on, how to establish training programs, including how to establish public funding. So there are 5 states that have gotten public funding through their Department of Health for these training programs. Then there are states where there's a state where moderate sedation is an issue, and advanced practice clinicians can do abortion care, but they can't provide moderate sedation. And so getting them hired is difficult because there are a lot of clinics that feel like if they already have to have a physician in the clinic on this particular day to provide that moderate sedation, then what is the value of having advanced practice clinicians providing this care? So trying to fix some of these, and these are deep policy issues that, it's taken us a year to do a deep dive onto exactly what the tiny little issue is that is creating that blockage, and then trying to figure out from there, okay, what's the quickest fix? And a lot of times there isn't a quick fix. Like the Practice Act is going to be changed in 2028. And so it's possible that in 2028 we could fix it with the Practice Act. And part of this job is of telling people and explaining to people that sometimes these things take time, and 3 years is really not the amount of time that you think it is, right? Like it's like this has been a very long process, but also trying to figure out if there are other pathways. So a lot of times I tell people that my job, and what I want to explain to people every time I get the opportunity to talk to folks, is that in a lot of the work that you're doing, you're going to run into doors, and you're going to run into doors all the time. And a lot of times people think, oh, I hit a door and I'm done. And that really can't be the answer. There are a lot of answers to getting around doors. There's a doorknob, there are windows, there are other doors. So it's oftentimes, and no matter what you do, that's true, that you have to sort of try to figure out what are the pathways around the problems that are standing in front of you. Taylor?
Sure, thank you. So my current days are filled with a lot of meetings. I'd say most of the day is filled with meetings where I'm working with a large group of people, a mix of decision makers and the individuals who are responsible for executing a decision, and trying to bring people, get everybody on the same page and draw out some sort of consensus to move a decision forward. Just ahead of this, I was in a meeting with our neglected tropical diseases team, just debating what the future state structure of the NTD ecosystem needs to look like to reach the foundation's elimination goals across 7 different diseases. So the meeting topics really vary a lot, but the fact that the meetings exist definitely fills most of the day. And then the rest of the day is filled with just kind of my own desk time and working time, doing a lot of like synthesis of different information or analysis to again help drive different decisions across the organization and get different align different points of view and getting different stakeholders to agree on something. I'll pass it off to David.
Thanks. Well, I'm currently retired, so I'll talk about what I did before I retired. And I had that job for about 12 years, and the first 6 years of that time, I probably worked with about 20 clients a year. The company had about 300 clients, and I'd get to about 20 of them in a year, and that would involve having a couple phone calls with the client, arranging to have a first visit with them, getting some idea of what they needed from me, taking it back, working on it, talking to the other people on the team about the project, and then eventually bringing it back and presenting it to the client. After doing that for about 6 years, I talked them into letting me do a monthly webcast, I think that was before Zoom was invented, so it was kind of out there doing something like that. But I eventually got it to we got an audience of about 150 of the 300 clients every month, and that was just fantastic because my travel went down from 3 weeks a month to 1 week a month, which I really liked. I liked visiting people, but I didn't like traveling. That was so and. Other than that, it was, phone calls and meetings. But when I started doing those webcasts, it was like at least a week a month preparing for the webcast to do an hour-long broadcast. An hour is a long time to fill if you want to try and fill it with something good. And who's left? I'm sorry,
It's me.
Matt, yeah.
So my day to day kind of follows a similar rhythm. So when I say work in the outpatient setting of the hospital, these are kids who are coming in for a visit and then leaving. Nobody's like in a bed or in the emergency room. Although I do work with many wonderful child life specialists, so that is a really cool job. Definitely check it out. But often about half my time is spent in face-to-face interactions with patients and their families. See kids anywhere from 0 to 21 years old. Many of my children are under the age of 10, so I'm mostly talking to their parents. And often what we are doing is we are getting information about the child's health and developmental history, the family history. We're going through a lot of education about biology and genetics, and the human body and how the kids' features kind of fit together with what's currently known, discussing genetic testing options, consent, and logistics for that. Genetic testing is often just a blood draw or a cheek swab or saliva. So the sample collection is not the risk, but the risk is really what you could learn when you open up this box. And I mainly work with kids who have the rarest of rare conditions. So it is a very common, normal day for me to get a diagnosis back for a kiddo where they're the 8th person in the world diagnosed with this. And I have one paper that we're working off of, and that's what we're trying to figure out and interpret, see how good it fits for the child, make sure the family understands. If the kid is old enough, make sure they understand what's going on, and then how this could affect the kid's healthcare, development, next steps for the family, reproductive planning. I'm not a prenatal genetic counselor, so sometimes we're referring parents to go work with those individuals for their own family planning. Sometimes I'm talking to teenagers about what this will mean in a couple years if and when they're ready to have kids. So a lot of my time is either spent doing that or preparing to do that or following up from doing that and finding these resources and supports. Sometimes I'm emailing researchers all around the world to try to get our kids connected. We're looking into clinical trials. So it's a very cool and challenging position. So the flow is different, but you just never know what's going to walk through the door. We call it our zebras. It's a mascot of rare disease. So I love caring for all our zebras, and it is never a dull day in genetics.
That's amazing. One thing that strikes me about what you all just described is how important for each of you in a different way it is to be able to communicate clearly. So in child life, you're communicating with the child, you have to do that in a particular way, right? For Sabina, you're communicating with potentially a child and a parent, and think about how to do those two levels. Julie's making arguments that are policy arguments, trying to figure out how to be persuasive. Taylor's synthesizing a lot of data and analyzing and then communicating that back to teams to enable their decision making. And then, Dave is talking with clients or was talking with clients and then even doing a webcast, to reach more people. So that's just a really common thread here. So it's great that, our students have the opportunity, whenever you have the opportunity to present something to a group or to do that kind of communication, absolutely take it, even if it seems scary. I know a lot of you guys do that on our research symposium, research and experiential learning symposium day, and it's always great to see that happening. So we have a couple questions, so I'm going to let's do those from the folks in the webinar. So what are some good paths for someone originally interested in nursing, but now interested in biostatistics? I don't know if this is a Julie question or a David question. Like, I don't know, or if anybody has any thoughts here.
Well, the actuaries that work with health statistics are working with some combination of looking at the statistics of what treatments people have to combining that with cost information about those treatments and trying to set up a payment system usually to balance the costs and the payment.
Great.
I think that I would have a question around, is this person planning to continue in nursing and also do biostatistics, or is this a shift to biostatistics? But there are certainly a lot of folks, many of my colleagues who are nurse midwives and nurse practitioners who also are researchers, and biostatistics plays a big part in their role and in the research that they do. And it's certainly absolutely necessary as we move that research forward to have a real understanding of biostatistics.
Yeah, that's great. Yeah, and so Miriam did say both ideally, which is the question you answered, which is terrific. Um, so yeah, I think that's great. And I also think having that sort of background in clinical care and then going into some kind of research field or data analytics field, but you have that background, you understand what you're looking at when you're doing the analysis, is probably useful in a whole lot of contexts, I would imagine. You might want to check out the co-op with Children's Hospital of Philadelphia that we have, just some advice, which is in data analytics, and see how much you really like that and how useful it might also be to have a nursing degree. So just a thought. So another question from a student. So for those with MPHs, so we have a master's in public health in the College of Health, and Julie's in that program. So is it possible to work at a foundation without a business background? What are some of the roles we should pursue beforehand if we ultimately want to transition into social impact or philanthropy? So we have sort of two nonprofits here. So Gates Foundation, Mindful Child Initiative. So I don't know, or if anybody else has knowledge of this, would be great to hear. But what would you guys say, Sarah and Taylor?
Yeah, I have my MPH, and I think with nonprofit work and philanthropy, it's important to show impact, of course. And so data collection and research and having your MPH, that background is important. And so depending on the field, it's also just exciting to have this background in biostats and other courses through your MPH to be able to really hone in on a topic that you feel passionate about. So for me, it's mental health and youth. And so I've been able to use my MPH through the nonprofit to then continue to do research and to study what I feel passionate about. So I think that's key too, is when you eventually want to go into a field that it's really important to you personally. I think that's huge. And then you'll figure out how you can use your degree.
I think the only thing I would add, I agree wholeheartedly with everything Sarah said. I think the only thing I would add, just to put it in context of like the Gates Foundation, the specific role that translates into, that a lot of people with MPHs find themselves into, it's called the program officer role. So they are responsible for investment making and grant making within a particular program strategy team, whether it's like the polio team or malaria team, or another area within our global health division. So
Great, super helpful. Thank you. But those are both really very helpful answers. Okay, so we have one more question that just came in. So this is for Sarah. So are there ways to shadow or get involved or intern with a child life specialist? Currently, the person writing in is an EMT.
Yeah, so and are they local? Like in the Lehigh
I
Valley?
think they're a student, yeah.
And okay, yeah. So like I said, an internship, it's a 600-hour internship as part of the certification, but they also, a lot of children's hospitals offer practicums, which is only 100 hours, and you can do that while I did that while I was um an undergrad, but you could also do it during your graduate degree. And I think that both St. Luke's and Lehigh Valley, I know they both have child life departments. They're very small, but I'm happy if they want to reach out, I can connect them to their directors, just to get a taste of it. I think it's really important to go in and see and experience what it is. So yeah.
That's great. Thank you so much, Sarah, for offering.
Sure.
Um, so yeah, so I guess, Jen, can you share Sarah's email? Maybe, I don't know, can you individually email students?
So yes,
That-
absolutely. I'm actually
You'll do that?
typing to that student right now.
Oh, perfect. Okay, good. Okay,
Yeah.
good. All right, terrific. So, oh, I see. Yeah. Sorry, I am trying to get rid of questions. Okay, awesome. So I wanted to sort of ask now, what do you like most about your current position? Yeah, what gets you going back the next day? Let's see. Well, who do we want to start with? Julie, let's start with you.
I love this is my dream job. I when I was in when I was a child, I wanted to be a lobbyist, and I thought that that was my
Ah,
sort of dream. And then I had a lawyer friend, or my parents had a lawyer friend, who explained to me that I had to become a lawyer in order to become a lobbyist, and explained that most lobbyists work for organizations that are uh, not social justice organizations.
yeah.
And so I became a little disillusioned. But it is pretty much exactly, I am doing pretty much exactly what I had sort of envisioned, where I am fixing some of, or trying to repair some of the problems that exist within these policy situations, that some of which are intentional and some of which are unintentional. And
Mhm.
I think having the background in healthcare and having been a clinician for the number of years that I was gives me a very specific sort of expertise in this work that I have then been able to leverage to really do these other pieces. Also, the being part of the case in Maine, the federal lawsuit, I was trained in media. I was trained to talk to
Mm.
journalists. I was trained to so I get a lot of this training that we do not get in generally. So one of the things I'm working on right now is getting funding for a year-long advanced practice clinician advocacy program, which will do the same
Mm.
thing. It will train our folks in media. It will give them on-camera training. It will do all of these pieces, and so I think that's a really important piece of it too, because I think a lot of the ways that we can change the public discourse is through the ways that we use media.
Mm. Great. Sabina?
Yeah, I really enjoy my job. There's kind of two main aspects of it that, I find really rewarding and fulfilling. I do really enjoy the human interactions of it, helping people understand what's going on, even if we don't get an answer for why their kid's having their difficulties, um, is incredibly rewarding. And then the other aspect of it is genetics is cool. Like, there's not a single day that doesn't go by where I'm like, wow, like I am learning new facts every day. And even my geneticist colleagues who have been doing this 30 years, we still around the water cooler, holy cow, this is so interesting. This is so cool. I didn't know that. And so being able to kind of sit on that kind of cutting edge of medicine, as I mentioned before, as well as to then bring it specifically to a family like the next day and help them navigate this and answer questions sometimes that's plagued families for decades and generations. Is It feels really good. Sometimes it's sad, but it's usually very happy and very rewarding work. So the nerd and the extrovert are very happy at this
Oh,
current.
that's great. That's awesome. Taylor?
In some ways, I think what I enjoy most is quite similar to what Sabina shared, but for me, it's who I get to work with and who I have access to. It's such like an eclectic group of people who come from such a diverse background, and I too come from such a diverse space compared to most of the people that I'm liaising with on a day-to-day basis. And so I am constantly learning something new and in a way that just like gets me excited every day to dig into like the next new topic or have the next conversation to learn more about that particular disease area or whatever it might be. So I think it's just the people, the diverse group and really who I have access to. It continues to keep me really excited.
Yeah, I mean, so already a theme is emerging around sort of this continuous learning and this sort of love of learning, even in our first three answers here. So, and also a sense of purpose. So those are both great. David.
Yeah, what I liked the most about my work was the problem solving,
Mm,
solving a difficult problem. They were never the same twice, ever. That I had to repeat any work. That something was always new and different. I had to figure out, okay, this doesn't fit with the way I did it last time, and how do I adjust this? But the other half of it was I really learned that I loved helping people.
mm,
And I learned that because of the time I spent at the rating agency where I wasn't allowed to help people. My job was to judge people. And
oh,
I found out that I hated that.
yeah,
And I really, when I left there, I really liked going back into helping people again. That was just something, I learned about myself that way.
that's great. Yeah. Sarah?
Yeah, I feel the same way. When I describe the nonprofit, it's very hyper local right now, and we really are right in with our community. I went to school all through the Allentown School District, K through 12, and we are currently in all 16 Allentown elementary schools and the two
Mm,
high schools and the middle schools. And I grew up as a kid who like really had trouble identifying my feelings and like what I was feeling. And that's what we're teaching kids. We're
mm,
not just going in though and saying, talking about stress and mental health and anxiety. We're just simply giving them tools, throwing tons and tons of tools at them, and a lot are sticking. And I think from an MPH standpoint and data collection, and like Taylor mentioned with grant writing and finding funding, I'm constantly learning too. And I think it's really cool to see your local community impacted by the work your team is doing. So
mm.
that's been pretty awesome for me.
That's really cool. So I'm asking a follow-up question on those questions, which is, what's the one thing you've done, like whatever comes to mind first, that you're most proud of in your current position, let's say, or in your former position?
I can go.
Great.
So I've been in this role for about 3.5 years, but I've been working for the nonprofit since 2016. But as a leader, we just secured a $500,000 3-year grant for a pretty tiny nonprofit because they saw the value in our programming. So that was an exciting moment about a year ago.
That's awesome. Congratulations.
Yeah.
Yeah. Anybody else have anything come to mind?
Well, it says on the screen below the name that I'm the editor of the Actuarial Intelligence. That's the AI Bulletin. And as a retired person, I have switched my focus from what I was doing to working with AI, and I am helping young people learn about using AI. So that's I'm very proud of doing that.
Cool. Great. Anybody else?
I mean, I think, being the lead plaintiff on the lawsuit was
Mm,
really was a huge uh, life shift for me. It allowed me to do a lot of the things that I'm doing now, right?
yeah.
But there's so much that I am just very excited to be able to do and to shift the landscape of the way that we talk about and think about abortion care. And I actually think that, you know, abortion stigma and abortion exceptionalism exists partly because we think of this as a physician role and we think of it as more complex and difficult than it is. And when we are able to shift that to talk about how, this is not a complex procedure and it's not difficult um that we have the opportunity to sort of shift that entire landscape.
Very cool. Great. Anybody else want to jump in? You don't have to.
I can go.
Yeah.
Um, this was actually the first project that I worked on at the Gates Foundation, but I helped operationalize a program that by the end of the 4-year program will reduce under 5 child mortality in Niger, Mali, and Nigeria by 13% through
Wow.
biannual mass drug administration of azithromycin. And so I think coming into my role, I definitely had a bit of an imposter syndrome coming from the corporate world, but it was like handed to me on the silver platter of, okay, here's an opportunity for you to show that you can also help deliver impact in these low and middle income country settings. So it was really, really rewarding and something I'm very proud of.
It's amazing. Yeah. Sabina?
A lot of my proudest accomplishments are HIPAA compliant, so I cannot tell
I
you
was
more
thinking
details
about that actually.
about
Yeah.
them.
Okay,
But
fair.
in a more career-wise setting, I've really been proud of the continual work that I have done and my clinic has done to improve access to care, reduce wait times, and to make sure that more kids in our region of the country have reliable access to genetic services. And I helped establish a couple different clinics within our department that brought our wait time down by 6 months. So
Wow.
that brought me a lot of joy. Yay for the kids.
That's awesome.
Yeah.
Love that. So, turning to the other side of things, what are some of the challenges that you face in this career? Well, who should we start with? Let's start with Taylor.
Okay, I think for me in terms of like my day-to-day role and what I am accountable for in my work, it's actually I mean, there's obviously I can't talk about my work without talking about some of the external challenges, but I'll focus
Yeah,
on the
exactly.
internal
And that's
pieces since
important.
everyone is aware of that. I'd say it's mostly the managing the stakeholder dynamics, or for lack of a better term, the internal politics. You have very tenured individuals who are coming from different fields and bringing different perspectives on how to solve the same problems. And so much of my time is just spent trying to align those different perspectives and like find the path of least resistance. And it's like equal parts one of the most rewarding things about the job, but then on the other side, it causes the most, challenges and like friction on a day-to-day basis in terms of what I'm responsible for.
Makes sense. Dave, what was challenging about your work?
I guess the thing that was challenging for me was learning the communications aspect of it. Going into it as an analytical person, used to doing things with a computer, with the math, and had to learn that was only part of the job. That a big part of the job was getting the other people that weren't the analytical types to buy into the conclusion you were able to reach from the analysis.
Yep, that makes sense. Yeah, you can go in with different kinds of strengths and still develop, in your career, and you need to develop in your career, which is great. Sarah.
So I think advocacy in general for the importance of both a child life specialist and for the nonprofit work, and especially with a child life specialist, the actual department and child life specialists in general don't make the hospital money. So it's a constant sort of proving that we increase patient satisfaction, that it's important for children to have a good experience when they're going throughout the hospital and through healthcare, but it's ultimately not making the hospital system money. So that's always us trying to essentially prove our worth day to
Mm.
day. And then even same with the nonprofit work is showing that this essentially preventative mental health care and resources are really important and ultimately does save money or help, the economy. But we have to, with research and the why, prove that pretty consistently. So.
Mhm. Yeah, that I can see that. That's an important aspect, I think important to know. So Julie.
I mean, uh, the landscape in which I work is complex all the time. It's been more complex. The work is never going to go away. The overturning of Roe in 2022 was huge. And it's a battle all the time. But I think, and you have to think of success as incremental, and you have to uh I think for a lot of people get frustrated and they leave the space. But for
Yeah,
me, those small steps are huge, and they're how we kind of um will regain ground. So,
yeah, that's great. Yeah, so you just keep you mentioned earlier this idea of not, you meet one closed door, you don't give up. You look for the doorknob, the window, the whatever. So there's a sort of sense of really needing to be persistent to be effective there. Yeah, that makes sense. Sabina?
In the day-to-day misinformation,
Mhm.
I work in the autism and intellectual disability
Mm.
space. There is a lot of parents asking a lot of questions. There's a lot of guilt and fear.
Ah.
Also, Jurassic Park has led to a lot of questions that are wildly inaccurate. And the
Wow,
general,
interesting.
I finally watched it and I was like, oh, I know where these are coming from. And there's just a lot of education that needs to be done about genetics, both in just the purely how this all works, and then also the quality of genetic testing. No two genetic tests are equal. But then on the bigger scale, it's definitely access to genetic testing and genetic counseling and genetic services, both for our area, we're like the biggest pediatric providers for the entire WWAMI region, so the whole kind of Pacific Northwest, as well as just getting genetic counselor time reimbursed from Medicare and Medicaid. Now, the National Society has put forth some legislation in terms of trying to get genetic counselors as recognized providers. And just like what Julie's been up to, it's been a lot of work to expand access to these necessary services.
Hmm. Yeah, I can imagine. That's really, really interesting. So students, you're welcome to continue submitting questions. I have one more question for the panelists, which is, what advice would you give a College of Health student as they work toward figuring out where to start with finding a career? Sarah smiled, so I'm going to call on you.
Yeah. I think just like say yes to opportunities, even if you don't think it's for you. Like I did so many random like internships and shadowing and things that like I did a podiatry camp. I don't know. I did like every little because I just really didn't know. And I think you learn from all of those experiences and it sort of leads you on this path of like realizing what you are good at and what you're passionate about, and you'll find like a good mix. But I think just like continuously say yes and you'll find your path.
Great, great advice. Who wants to jump in?
I can just add to that. I would have said the exact same thing. But what I'd add to it from being a little bit older than some of the people on the call here is that I don't think I found the exact career I wanted until I was in my 40s.
Hmm.
Uh, and I really enjoyed the last 20 years of my career. Um, but before then, I did just what Sarah just said. I tried lots of things.
Great, great advice. Yeah, Julie?
I agree with that wholeheartedly. Again, thinking about like being wanting to be a lobbyist as a child, making all kinds of changes in my career path. I was still working in clinical care until my 50s, and could not have foreseen this particular position being available. I mean, I imagined I wanted to work in executive leadership, but this specific thing. And I think it was because I said yes to so many things. And
Mm.
I joined boards and I made
Mm.
connections and I networked and I got to know so many people in the landscape that, that this became possible.
Cool.
I think
Anybody
definitely
else? Advice? Yeah, Sabina, thanks.
building on that, right? Trying different hats on, right? A lot of the people on this call went and got other training beyond an undergraduate degree. And before committing to more intense graduate degrees and experiences, having tried it out first. I work with many MDs and PhDs and folks in all different specialties. And the people who took the time to have other jobs before grad school, sorry if you're already in grad school and didn't do this, really had the most success and fulfillment with that transition from kind of school into work. And the careers that we do now are not going to look the same 10 years from now. My job will probably be wildly different. Technology that I was told was standard of practice in 2019, I was just told will be phased out in the next 2 years. So it's all about skills. You will get the knowledge. You guys are smart. You made it into Lehigh. You're making it through Lehigh. You'll learn the knowledge, focus on skills, and trying new things.
Awesome.
And my advice.
Great.
I think I'm the only one who hasn't gone yet. I think what I would add to all of that is that I think there's pressure to have it all figured out on day one when you're about to graduate, and you should really feel the opposite of that, is you really don't have to figure it out on day one, because your career is going to be formed over the course of decades, and you'll probably have multiple different careers, kind of in line with what everyone is saying around try as many different things as you can and kind of know yourself, learn yourself. And so I think you can also look at two people who are in the exact same role, and I guarantee you their path there looks entirely different. So there's multiple different pathways to get to where you want to go. And yeah, I think that's all I'd add.
That's great. So we have another student question. So this will be our last one because we're almost out of time. So this is a great question. How can individuals with experience from different systems meaningfully integrate into the U.S. professional environment while ensuring their prior experience is recognized and valued? So this is particularly from an international perspective. And then a second question, how can one effectively translate their skills and experience in a way that aligns with U.S. context, especially considering cultural and structural differences? Those are really good questions. Anybody have any thoughts on those? Those are tough. I don't know that anybody here has direct experience with this. I don't know.
I didn't live that, but I did have a number
Yeah.
of friends as I was coming up, and what I think the ones that were the more successful ones were just not as shy as their culture would have told them to be. And they were willing to put themselves forward, willing to say more about what they could contribute, and willing to bring their perspectives into it. And that's just not what a number of the cultures these people came from would have had them doing. So it was a big step for them, I think.
Yeah.
I feel like American exceptionalism is real, and we think that we're the only ones who have, and this has been my experience with the work that I do as well. We knew and had evidence globally about advanced practice clinicians, particularly midwives, being able to provide this care, and were unwilling to integrate it because we hadn't studied it here in the United States. And since we hadn't studied it here, it couldn't possibly be, you know. And so I would say that there is a lot that we can gain from international students and from their experiences and from their cultures. and find your allies and mentors who respect and value that experience and can help you translate that into the work, because I think there is a lot that we can learn from
Mm.
folks outside of the United States.
Mm. I think that's an excellent point. So anybody else want to weigh in on that one? No. Okay, well, I just really want to thank everybody, all the panelists. It was a great discussion. It's amazing the work that you do. I got like goosebumps several times during the conversation because it's just really important work that you're doing. So thank you so much for sharing that with us, and inspiring students. So thank you, students who attended, for your great questions. And if you didn't ask a question, that's okay. You can always follow up, reach out. So everybody have a great night, and go Lehigh. Bye.
Yeah.
Bye.